everyone for coming to this talk. Today, I'm going to take you to the Brazilian Amazon and talk about health impact of gold mining. So this work is in collaboration with Ana Peggi here, and Jacqueline de Aguiar in Roraima in Brazil, and Robert Heltmeyer. So for people in this room, when we think about the Brazilian Amazon, we might be picturing lush rainforest, high biodiversity, and maybe really rich indigenous cultures. However, that's not the only thing that Amazon offers. Amazon is also very rich in gold deposit, and that has drawn millions of people since the 70s to do small-scale gold mining. So this activity provides livelihood to a lot of people who lack alternative economic income. However, it is also concerning because increasingly we're seeing these activities, which are mostly illegal. They are encroaching protected areas and indigenous lands. And you may have learned from news about the crisis in the Yanomami indigenous territory in northern Roraima, how violence and diseases were brought to these very vulnerable populations. So there are two major mechanisms through which gold mining affects health. The first one is through mosquito-borne diseases. So you can see from the picture in the background, small-scale gold mining creates a lot of ponds that are ideal breeding sites for mosquito species that transmit diseases. And the other factor is that gold miners are a highly mobile group. So as they travel between cities, between different sites, they can increase the transmission of mosquito-borne diseases because a lot of times they also don't seek immediate treatment. The second mechanism is through the use of mercury in the extraction process. So mercury is widely used in small-scale gold mining to bind the fine gold particles, but they are not always recycled properly. So a lot of mercury just gets released into the environment, bioaccumulates in fish. And in the Amazon, we know that this is one of the regions with highest fish consumption, and indigenous people and local communities are especially dependent on the fish diet. So when mercury bioaccumulates and gets into human bodies, we see a variety of symptoms from neurotoxicity, fetal abnormality, kidney dysfunction, immunotoxicity, etc. It's especially concerning for pregnant women because they can have very negative impact on newborn health. So in this research, we ask two broad questions. We want to understand how gold mining affects both the spread of mosquito-borne diseases and the impact on mercury-related health outcomes. And we're also interested in understanding the differences in different populations. So what is the effect on the general population versus the indigenous populations in the Amazon? Previous public health studies have looked at these relationships. However, most of the studies have been correlational, and they focus on smaller geographic regions. And these correlational methods have some limitations in terms of isolating the effects of gold mining from other confounding variables. There are a few recent causal inference studies that looked at impacts on malaria and newborn health in Colombia and the Philippines. They also have some methodological limitations that we are trying to improve in the study. And finally, to our knowledge, no one has comprehensively examined health impact of gold mining in the Brazilian Amazon, which leads to limitations in terms of policy interventions in this region. So we are trying to use an improved causal identification method to ask this question about gold mining's health impact in the Brazilian Amazon. And the method we use is called Bartik shift share instrumental variables with cluster LASSO variable selection. So I'm just going to take some time to go through this slide. Imagine if we naively compare municipalities with gold mining versus municipalities without gold mining, where we won't be able to isolate the causal effects of mining from all the confounding variables because where mining happens may not be random. It might be affected by remoteness, infrastructure, GDP, etc. So what we are trying to do is to find some instruments that can predict where mining happens, but does not affect health outcome in any other way than through gold mining. And in order to make this estimation more robust, we actually use a shift share instrumental variable design, which is an interaction between two types of instruments. So we use rock types, geological features that can predict gold suitability, interacting with international gold price, because we know that especially small scale gold mining respond very well to price fluctuation of gold. And what we're arguing is that first, in the first stage, the interaction of these two variables can predict gold mining. And I'm not going to show you the results just because of time limits, but we have a very strong first stage with very high statistics, so it does predict gold mining. And then we also argue that these variables do not affect health outcomes in any other ways. And we do this by showing a variety of tests on variables related to health outcome. Now, once we have the instruments, which were selected using a cluster LASSO method to reduce the number of instruments, we then look at the second stage, which is using these random variation generated by the instrument to look at health outcomes. And we look at two categories of health outcomes. So for mosquito-borne diseases, these are malaria, dengue, Zika, chikungunya. And then for newborn health indicators, we look at APGAR score 1 and 5, which are indicators of newborn health after 1 minute and 5 minutes after birth. And then we look at birth weight and infant mortality. So now I'm just gonna show you a series of results. The first one is looking at malaria prevalence among the general population. And what we're looking at in this graph is the coefficient estimate, as well as 95% confidence interval. So if it's significantly above 0, then we're confident that it's a significant outcome. And what we're seeing is that gold mining does increase malaria among the general population. A back of envelope estimate shows that approximately 7,000 additional cases were caused by the increase in gold mining area in those gold producing municipalities. For other mosquito-borne diseases, the coefficient is smaller because these diseases are less common in the Amazon, but we still see significant impact on dengue and Zika for the general population. Now, moving on to indigenous population, we do find significant impact on dengue and Zika again, but for the malaria outcome, we actually have a highly imprecise estimate. And one of the things we've learned in the analysis process was that there are a lot of data uncertainties with indigenous data, which I will talk about in the policy implication section. Now, moving on to mercury-related outcome. So first, I want to draw your attention to the lagged years. So we actually, for this outcome, we used lags to look at gold mining's impact a few years down the road. Why do we do that? Because gold mining takes time to mercury takes time to bioaccumulate in the environment, and it takes time to show up in health outcomes. So what we are finding is that for APGAR1, it doesn't seem to have a significant impact on the general population, but it does for the indigenous population, and the effect size increases over time. We have a very similar pattern for APGAR5. And for birth weight, here we see negative impact for both populations. So, but again, indigenous population see a stronger effect. And we also looked at impacts on indigenous infant mortality and saw, again, a significant impact over time. So to sum up, we have found that gold mining caused increase in the prevalence of mosquito-borne diseases. It caused a negative impact on newborn health, especially among indigenous peoples. Gold mining is extremely difficult to regulate. It's due to the large population involved in the activity. A lot of these people don't have good alternative income sources. And finally, it's also like strongly tied to local politics and interest groups, as well as organized crime. So it's not going to disappear from the Amazon anytime soon. However, we are suggesting that any method that can reduce the health impact will be welcome. So one of the things is mercury recovery technology. There are also NGOs trying to promote the reduced consumption for certain types of fish. So coupled with providing alternative protein sources. And finally, timely diagnosis and treatment for diseases for minors actually matters a lot because that reduces transmission of these diseases. One other thing we learned in this process is that we need better monitoring of indigenous health in order to understand and timely respond to mining's impact on these very vulnerable populations. So with that, I would like to thank many people who have spoken with us and shared their understanding and expertise in this topic, and our donors for supporting this work, especially field work in the Brazilian Amazon.